There are institutions that, because they say you build your hospital from the outside in versus the inside out these days. So you think about what else societies, certain aspects and pieces of society needs, what community needs, and build that into those hospitals where it is a beacon for all those different pieces about life for people to be able to live fuller, healthier, and lives where they feel that they can flourish. So the H, I think, is more set up where it's this institution where, unfortunately, a lot of people fear it. You know, if I come in here, am I going to get safe care? Am I going to make it out? And we have those fears anyway. I mean, think about how we feel going to the dentist, right?
Right.
But I do think that there's more, if we can turn the tide, and I think the pandemic set us back, but if we can turn the tide back to preventative health, right, and provide the services those community needs. Every community has a community health assessment that's done by the community health department every few years. That is a driver for what hospitals should set up to support that community.
Yeah, so that brings me to another question. The whole thought process to me behind a hospital has been to centralize a lot of the care. And so that was seen to be intentional. But I do see healthcare organizations, even hospital systems, are starting to build more facilities out in the communities themselves. Do you feel like there's more work that could be done to make it more a part, like embedded into the community, or is it still going to be the situation where you're going to have these very large facilities where they're just centralizing all of the care? I wanted to get your take on that. Just what are you guys seeing?
Yeah, and it doesn't have to be the hospital building different centers here and there around the community. It's the relationships. Someone mentioned recently that I learned about, collaboration is a competitive edge for any organization, right? So it is the barbershop down the street. What's that relationship between the hospital and that barbershop to make sure people in those spaces are being cared for appropriately?
I never would have thought of that.
Right? It is the laundromat and what can be set up there, right? For people that are waiting for their laundry to get done, what screenings we can do there. Like, there are all these pieces and places where people gather where those are the offshoots for how we can continue to address care in those communities. Because one thing that I've realized more and more recently, and I'm still doing some research on this, a lot of communities zip codes where hospitals sit, people are not necessarily, you think automatically that since the zip code is where people live, is where the hospital is, they're automatically healthy because they're right there.